I think it's very largely to do with the pandemic. So these medical records show that drop since before the pandemic. And of course, then people were frightened at the beginning to go to hospital or go to any kind of clinic where they thought they would bump into other patients and pick up COVID. So there was the infectious risk. But also, I think they realized that all doctors were extremely busy looking after sick patients and rolling out the vaccination program. And I think many patients felt that they didn't want to bother their doctor too much, that their symptoms could take a back seat for a little while. Um, and actually, that shouldn't be the case. The NHS is still open for business and is there for them, because we know that ignoring symptoms that are not normal for an individual can point to something that could be something quite serious. Um, and so many of the inconvenience and embarrassing symptoms that women and anybody with gynecological organs experience are they're uncomfortable, they're worrying, and we would always much rather put people's minds at rest and sort out any problems early so we get better outcomes.
What are some of the telltale signs that perhaps, people should be looking out for, that should push them to definitely go and speak about these things regardless of how difficult it is, and seek that medical advice?
We call them the red flag symptoms. So red flag is an alert to something that could be potentially something quite serious. Most problems won't be. Most problems will be benign. But for example, if a woman who'd gone through her menopause suddenly started to experience bleeding again, that would be a red flag symptom. But younger women in their reproductive years, if they were having irregular, more heavy, painful periods, that would be a reason to ask for help.
I started having periods when I was about 16, and sort of right from the very start, they were incredibly painful, really heavy, and I went back throughout my sort of school career, so for the last 2 years, multiple times to try and get a bit of a clearer answer, because I kind of just felt we were masking the problem and not really addressing the issue.
How long did it take from, you sort of first getting your periods and thinking, gosh, this doesn't necessarily feel right, to then getting a diagnosis? What was that time period like? And how did you feel in that space? Did you feel supported and seen and heard?
So it took 8 years in total, and it was like quite through critical points of my life. I left school, started uni, left uni, started a full-time job, and I didn't feel supported through the NHS, to be honest. Sort of really let down and betrayed, because you want to believe the people who know more than you, who are in the medical profession, and when they're saying it's just one of those things, it's not that big a deal, you just need to learn to deal with it, there's nothing we can do, then I felt really sort of weak and sort of devalued as both as a person and as a woman. You have to really sort of have resilience within yourself to keep going back and saying, I think you're wrong, I know my body and this isn't normal. And it's hugely draining and just incredibly frustrating to keep having to go, you're not listening to me.
There must be many people that are listening to this and thinking, I can relate to that. I know my body and I know something doesn't feel right. If they are going through anything similar to what you went through, what would your advice be?
One of the best things I found was keeping a symptom diary and just going with sort of papers of evidence to my appointment, because GP appointments are sort of 8-9 minutes and you never really see the same person no matter how much you try, so you have to go through sometimes years worth of stuff very quickly.
We heard from Morag, who it took 8 years for her to be diagnosed with the issues that she had. Are sort of patients listened to when it comes to these concerns, or can they often be dismissed as, oh, it might be IBS, you might just be overly sensitive, or it's sort of not something you need to worry about?
Absolutely. We know that 1 in 4 women will say in surveys that they don't feel adequately listened to when they talk about any gynecological symptoms. Now, that's not good enough. What we want to do is to encourage women to express all of their concerns about their symptoms and be heard.